afternoon. I'm Kristin Fountain with Cape Fear Newspapers, and you're watching Community News Today on Topics Design TV. We bring you all the community news from Pender, Duplin, and Onslow counties. Now for the latest news from Pender County and the Sea Turtle Hospital. It's not easy being green. Sometimes high tech comes to your door and arrives under the name Prius. In October 2008, the Surf City Sea Turtle Hospital admitted 10 cold-stunned turtles in the course of a couple days. By now, they're pretty good at identifying sea turtle species, but this one particular patient had them all questioning their highly honed skills. Her paperwork said green, but looking at her, they knew there had to be a more interesting backstory. As a cold stun, she received weeks of daily hands-on care, so they all got a chance to examine every scoot and scale close over a long period of time. When she was resting on her plastron, or stomach, she looked very much like a loggerhead, but when she was lying on her carapace, or back, she definitely gave off heavy green vibes. Her lack of preference for a certain type of cuisine didn't provide much of a clue. She gravitated toward being a carnivore, snarfing fish, squid, and crab like a loggerhead, but every once in a while she showed some interest in lettuce, like a green. If she was confused, so were they. The mystery of her lineage kept nagging at them, and even though almost everything about sea turtles is enigmatic, they finally had the tools to put this particular matter to rest. During her pre-release tagging, the turtle vet, Dr. Craig Harms, took several small tissue samples for DNA testing. The tissue took some time to find its way to the appropriate researcher, but now the results are in. Prius is a true first-generation hybrid. The mother was a loggerhead, and the daddy was a green. Even sea turtle love is blind. They would like to say thanks to everyone who came out to the training sessions for beach walkers. As the island continues to be a favorite nesting spot for mother loggerheads, and thank you to the Topsail Turtle Project volunteers. It's a safe and protected one. Although it's a bit early for the arrival of these big girls, the turtles, not the walkers, we're definitely advocates of being prepared. May 1st, the official start of nesting season will be here before you know it. If you missed the meeting but are interested in joining the Topsail Turtle Project, contact their Director of Beach Operations, Terry Meyer, at topsailseaturtle@aol.com. On their website, you can follow the progress of the patients and the new building by visiting them online at www.seaturtlehospital.org. In other news, a road by any other name would cost about $2,000. A proposal to change the name of North Carolina Highway 50 from the bridge west to the Highway 210 stoplight at Roland Avenue was unanimously defeated after Surf City Town Council members heard nothing but negatives about the idea. The stretch of the same road from the bridge east to the other Highway 210 intersection already carries the Roland Avenue name. There were very few residents or business owners on hand for the public hearing about the name change. They had made their wishes known in other ways. Town Clerk Patty Arnold read several comments sent to the town, most from business operators, who complained of the cost involved in changing stationery, business cards, and invoices. Bill Backholm, the operator of Gilligan's, a nightlife spot that gives its address as 14895 Highway 50, wrote that a road name change would cost him as much as $2,000 to apply for a new liquor license. According to town manager Michael Moore, there were at least 8 businesses holding some type of liquor license along that stretch of road. The council was considering the move, Councilman Douglas Medlin explained, because some people had asked that it be changed. I don't think they realized all that was involved, he says. In other business, during the meeting, the council approved 2 resolutions that will help move along a project to build a wastewater treatment plant off the island. The first resolution seeks $50,000 to repair a retention pond at Juniper Swamp that isn't retaining because of leaks through the soil. Another resolution for a $5 million loan would go to a wastewater irrigation system. The actual cost for the projects won't be known until the contract bids come in. Also, the annual beach sweep will begin April 16th through April 30th. Recently, U.S. House Representative Mike McIntyre was honored for his work in improving the social, economic, and environmental conditions of southeastern North Carolina. The Cape Fear Resource Conservation and Development Corporation recognized the congressman for his support of the Cape Fear R&D, which works cooperatively with individuals and groups to improve social, economic, and environmental conditions, thereby enhancing quality of life in Bladen, Brunswick, Columbus, New Hanover, and Pender counties. McIntyre is a senior member of both the House Armed Services Committee and the House Agriculture Committee. In our Duplin County news, State Representative Jimmy Dixon appeared before the Duplin County Board of Commissioners on April 4th to elaborate further on why he introduced House Bill 528. This bill would add a seventh at-large member to the Board of Commissioners and to the Board of Education. Last week, he contacted the chairs of each board and informed them of his action. A similar effort in the recent past didn't get out of the committee, according to Duplin County Manager Mike Aldridge. Simply put, it is a good time to review, courteously and fairly, the composition of these two boards, the Republican legislator says. My intentions, which I have expressed to some of you in the past, are to lead timely discussions before moving this or any other bill through the House. Dixon pointed out that the Board of Commissioners and the Board of Education elections are conducted in compliance with a consent decree order in 1988 by the U.S. District Court for the Eastern District of North Carolina, Wilmington Division. Much has changed in Duplin County over the last 23 years, and his main purpose in filing this bill is to set the stage and provide a starting point for proper and reasonable discussion that involves all concerned parties as it relates to the future composition of these two boards. Dixon explained that the consent order not only requires officials to look at a new census data relative to election districts, but to review the future composition of the two boards relative to public interest, current conditions, and changes in court decisions. Entered pursuant to this consent decree, Dixon says, the goal is to have discussions that will improve the efforts of the two boards in conducting people's business. In his travels over the last 6 years, Dixon has heard from people that they are tired of having their towns and committees divided into as many as 3 different districts in one town. Dixon adds he is serious about this issue. He agrees with the majority of the citizens that we need a better system than they have now. Things are different now than they are 23 years ago. It's time to review. Duplin General Hospital's 6-month transition from a publicly owned hospital to a private one, operated by the University Health Systems of East Carolina University, is proceeding well. Harvey Case, president of Duplin County General Hospital, recently told Duplin County Commissioners. Case made a presentation to the County Commission during its April 4th meeting in the Commissioners' meeting room. A groundbreaking is planned for May 5th at 10:30 for a new medical office building in Wallace. Case said present plans call for the 8,500 square foot building to be staffed by 3 or 4 physicians. The office would offer physical therapy and diagnostic services, Case added. In addition to the Wallace area medical office building, Case and his staff are also heavily involved in recruiting physicians as well as providing improved pediatrics and diabetes services to Duplin General Hospital. Another priority is a facelift for the hospital and an expansion of the emergency room. He presented some of the 9-bed emergency room's facts and figures. The ER gets 22,000 visitors a year. From 50 to 80 patients come daily to the ER. That's hard to handle with only 9 beds. Duplin General Hospital is a 101-bed, not-for-profit hospital located in Kenansville. The University Health System's website states that they work every day to improve the health of Duplin County's people. It's part of our commitment to serve as the hospital of choice for our community. And as an affiliate of University Health Systems, we give our patients better access to the resources, research, and clinical expertise of a major healthcare system. The hospital opened in 1955. The 9-bed intensive care unit came online in the 70s. The hospital added 55,000 square feet in 1989. It has 61 general and 20 psychiatric hospital beds, as well as 20 general nursing home beds and 3 shared inpatient ambulatory surgery operating rooms. The county commissioners voted to lease the hospital to the University Health Systems of Eastern North Carolina in September of last year. And now let's take a quick commercial break.